Hello, my name is Nefertiti Bird.
Speak up.
Hello, my name is Nefertiti Bird. I'm Miss Black, North Carolina, USA 2009. Here's a picture of me right here. And I brought this because looking at my picture, you would probably never know that my grandmother has had heart problems, that my mother is a diagnosed diabetic, and that I pretty much had to bear the brunt of taking care of my mom, my grandmother, when my grandmother was sent to the hospital off of a doctor's visit. My grandmother's 86 years old. She's just stopped working at about 84. So for her to not be able to afford health care at this age, especially working all her life, is really disturbing to me, and it's sad. And I think it says a lot about our future if we're not able to change things. My mother is a diagnosed diabetic, as I mentioned before, and basically through health and diet, she could change a lot of things. But if she was able to afford a program where they could get her on a fitness program or a better eating program, as far as health and diet, and she wouldn't have to be stressed out about paying for it, then I think things would be a bit different. We all have to do our part and take our initiative, and at the same time, if things are a little bit more available to you, it's easier for a person to be healthier. Basically, I'm a representative for the 50 Million Pound Challenge and the Heart Truth Campaign. And through visiting a lot of people throughout North Carolina, I hear the same thing over and over again. I hear a lot of women with the Heart Truth Campaign basically saying that they had a symptom of a stroke and didn't know it. One had a headache and wound up having a stroke. One had a heart attack, just off of regular symptoms. They didn't fall out on the floor or anything like that. And a lot of them really couldn't afford health care to make sure that they went to the doctor enough to get their tests or screenings, and that to know that the symptoms for women are a little bit different or much more different from men. And basically, I want to appeal to anyone who will listen, who's able to do something about it. I'm doing my part with my title, but also as a person and a North Carolinian. And I just want to be able to give the concerns and the shared concerns with myself, my family, and other people in North Carolina that I've talked to myself, to make sure that something is done to change the situation that we're in, and to not let people die in vain and pay for health insurance. And I'm embarrassed to admit it, but I don't have health insurance, and I haven't had it for a long time. I'm blessed to be well and healthy. I don't even have a physical, but I'll be getting one for our national pageant. I don't know how I'm paid for that, but it's going to get paid some kind of way, and that's the kind of situation we're in. Everybody should be able to at least get a physical, but anyway, I want to thank you all for what you're doing, and I'm doing my part, and let's all work together. Thank you.